Let's discuss how to diagnose neuropathic pain. Once we've done discussing the diagnosis of neuropathic pain, I will share with you what I think is quite a quick and relatively easy way to get a sense for whether you have neuropathic pain. The way your neuropathic pain is diagnosed should involve the following 4 factors. Somebody takes a good history from you. Somebody understands the symptoms that you're complaining about. Somebody detects signs of neuropathic pain when they examine you. And sometimes, not always, sometimes diagnostic tests can be helpful to help with that diagnosis. So remember, a good history is important for a physician to understand whether this pain is neuropathic. They need to understand what the causes of neuropathic pain are, and that can help them define whether this is neuropathic pain. So for example, if you've had a trauma, a surgery, an injury, a nerve can be damaged in that process, and that can trigger neuropathic pain. And that surgery can involve spinal surgery, can involve orthopedic surgery, can involve hernia surgery, thoracic surgery, amputation. There are many traumas that could injure a peripheral nerve and trigger neuropathic pain. Medical conditions like postherpetic neuralgia, diabetes can trigger painful diabetic peripheral neuropathy. Shingles can trigger postherpetic neuralgia. Cancer can commonly trigger neuropathic pain. That's either the cancer itself or the treatments of cancer, such as surgery or chemotherapy agents, can trigger neuropathic pain, as can radiotherapy as well. So a history combined with symptoms and then a good clinical examination can help your physician decide whether you've got neuropathic pain. If you've got numb part of the body, we call it hypoesthesia. To touch, to brush, you don't really feel anything, it's numb in that area. That may signify nerve dysfunction and neuropathic pain. If it's particularly sensitive in that area, that may signify neuropathic pain. Hyperalgesia, excessively painful stimulus, or excessive pain to a painful stimulus. Allodynia, light touch with a brush triggers pain. These may signify neuropathic pain. Once you've combined those factors, your physician may be able to say whether this is neuropathic pain in a definite fashion or probable or possible. That's the way we look at it. Is this definite neuropathic pain? Is this probable neuropathic pain? Or is this possible neuropathic pain? One of the other factors is diagnostic tests. You don't have to have a diagnostic test to diagnose neuropathic pain. Diagnostic tests are helpful. So for example, if somebody comes in with painful peripheral neuropathy, you've got to do some blood tests to make sure that this is not diabetes, if they don't already know they have diabetes. So blood tests can be helpful. You can look at blood count, thyroid function, renal function, liver function, sugars, as mentioned before, and sometimes vitamins like vitamin B12 need to be assessed because they can trigger some forms of neuropathy. Sometimes immune systems or immune dysfunction can trigger neuropathic pain, so that needs to be assessed. Scans can be helpful as well. So for example, an MRI scan detecting prolapsed disc pinching a nerve, which correlates with the pain that is painful radicular pain. Nerve conduction studies can sometimes be done, which will help detect whether a nerve is malfunctioning in some way. And a nerve conduction study is where electrical impulses are used to assess nerve damage. Skin biopsies, rarely done in the clinical practice, but it can be done for research purposes. So skin biopsy can detect the nerves and how the nerve endings can change associated with some neuropathic pain conditions. Something called quantitative sensory testing can be done, which is a group of tests that are done. These are clinical tests that assess the somatosensory nervous system and somatosensory function. We generally use this in research, in a research setting, and sometimes can be used as a supplemental tool in some clinical circumstances, but that's called QST, quantitative sensory testing, and that involves checking thresholds. That is where you are touched with something and detecting that touch, say, gets a little bit stronger with each test, and it detects the sensory thresholds above which you feel something. So that's for pain, touch, vibration, and even temperature. There are also some questionnaires that can be filled out that can help you define whether this problem is a neuropathic pain condition. One of them, as mentioned, is called the Central Sensitization Inventory, which is a questionnaire that can help decide or help your physician decide whether some of the symptoms are associated with central sensitization. Now, as mentioned, I want to share with you what I think is one of the easiest ways, or one of the commonest ways, to diagnose neuropathic pain. And if you're not sure whether you've got neuropathic pain, why don't you have a listen to this, try this out for yourself, and see if you fit some of the criteria. And remember, this is not medical advice, this is a suggestion for you. One of the questionnaires that you can check for yourself right now to help decide whether you may have some features of neuropathic pain is called the DN4 questionnaire. It was defined in France. I forget the exact wording, but it's the Delors Nociception 4 questionnaire. And if you score 4 out of 10, the question is whether this is a neuropathic pain condition. So let's go through those 10 features. If you have burning, yes. If you have painful cold, yes. If you have electric shocks, yes. If you have tingling, pins and needles, numbness, itch, these might all suggest neuropathic pain. Then when somebody examines you, or you can examine yourself for that matter, if you have hypoesthesia to touch or pinprick, so that means if you touch yourself lightly with a brush and it's numb, or if you touch yourself with a toothpick and it's numb, is this a numb area that signifies neuropathic pain? Or if you've got significant pain with brush, that might signify neuropathic pain. So not numb, but hypersensitive to brush. That's called the DN4 questionnaire. 4 out of 10, or more than 4 out of 10, is a suggestion that this may be neuropathic pain, and that's a validated tool in clinical practice. Another feature of neuropathic pain, which I haven't mentioned yet but I want to mention now, is nighttime pain. When you get into bed at night, you can't hide from the pain. That might signify whether there is neuropathic pain.